Peace be to you. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. I'm here with a very special guest to talk about being a health education specialist. So I'll let him introduce himself.
What's up, folks? My name is Alexander Molina. I'm from Los Angeles, California, Charles Drew University, Long Beach, representing the house. First time here on the East Coast, and I'm looking forward to talking about what is health education, whether it's West Coast, East Coast, globally around the world, and I'm looking forward to bringing that knowledge around the table.
Okay, so what we're going to be doing is just kind of shooting questions off of each other. We are part of the National Commission for Health Education Credentialing, and we had to go through this governing body to get our certification in health education specialist. So you get what's called a CHES after you pass your exam. All right, so I'll ask you first. What is what is a health education specialist?
Okay, so a health education specialist, that really transcends beyond what background you come from. I come from social work. Some folks come from a more clinical background. A health education specialist can really assess a community's needs and strengths. It can not only evaluate what's been working before, that baseline, but also can bring in participatory research and active work from the community members, understanding that the community members, the locals, the natives, are actually the ones that should be leading any movement, any health research project or initiative. And it allows a community to thrive based on the resources and expertise from that individual. So honestly, it's that train the trainer approach. A health education specialist comes in, provides the knowledge and the tools, and works with the community so that the community can define its health needs and could shape its own path for a better quality of life.
Yeah, and that's really your textbook answer, which is very accurate. There's a lot of stuff that we do that entails with that, and everybody has a different approach. You and I were talking earlier about you're from West Coast, I'm East Coast here in DC, but we have a lot of the same issues within our communities, especially our urban communities. We got homelessness, homicide rate, very high level of homicide rate.
PTSD, trauma, violence,
So we try to use our expertise to at least come up with innovative ways to overcome or address those challenges, those social challenges.
Right. And if I could kind of cut in there, a health education specialist is an adventurer, a traveler. Like myself, coming from the West Coast and venturing out to Hawaii, different parts of the Caribbean, it's important to go around and collect that global collective concept of what is health, what is the meaning of health, wellness, and happiness. Because once you travel around and you get an idea of what folks think alike in common or think differently, you really understand health as an international piece. Again, homelessness, mental health, are these things that people really focus on by themselves on an individual daily basis, or is this something that we think about every day and we just don't know our neighbors on the other side of the world, on the other side of the country, go through the same ordeals?
Yeah. And when did you get your CHES?
All right, so I'm kind of new to the certification. I just got mine last October, so October 2019. I've heard about it for quite some time, especially when I was going through my MPH program at Charles Drew University in South LA. It was recommended because coming from that South LA tradition of academics, the only HBCU university on the West Coast, west of the Mississippi, we come out of need. We come out of the Watts rise, the Black Power movement and struggle. Back in LA, Black and Latinos would die on the way to the General Hospital, especially during the 80s and 90s, would die on the way to the hospital. And MLK Hospital, Charles Drew, came out of the tradition of serving these underserved neighborhoods. So it's really promoted individuals from those communities to take stand, take initiative in learning the concepts, learning the health, learning the education, and then disseminating it back to the local, to their fellow community members.
What are some of the projects you're working on now?
Great. So to give a basic overview, right now I'm focused on reproductive health, specifically in the South LA communities. Back at home, we call it the 710 corridor or 110 freeway corridor. That means it's all the communities of South Los Angeles, Southeast. Mine are Linwood, Southgate, Hudson Park, Maywood. And I myself have always worked in that area from Hudson Park all the way down to Long Beach, Paramount, Compton. And looking at the basic patterns of why is cancer incidence so strong and prevalent by the freeways? Why is homelessness becoming this massive camping off the freeways or off the sidewalks issue? what are the patterns and what are the combinations, dual diagnoses between mental health and substance use, opioid use, vaping use. So we're telling a narrative on that 710 corridor, and what we're doing now with the well-being centers is we're trying to have youth advocate for themselves and advocate for their community so that they become the leaders of their own health movement and are able to pass down that torch of health and wellness along the lines.
Yeah. And you and I were talking earlier about like when we present ourselves to people in the community.
Right.
They're kind of like, well, are you a doctor? Now, I do have some medical training as a physician assistant, but you come from a social work.
Yeah.
Which is, in my opinion, a lot of hands-on. You like really get involved in the people's lives.
Yeah.
But I wonder, I don't know if you agree with this or not, but a lot of people's, maybe their reticence about, well, why should I talk to you? Because they don't know
Right.
about the health education
Right.
specialist field.
I think a health educator, what they have an advantage beyond just the training from the certification is that people skill, that concept and ability to connect with people, because automatically we're drawn to these concepts of public health, community health. That is a particular breed of a person. That person genuinely cares about their community or like similar communities around the world. So what we bring to the table from being a home visitor is truly the intention to understand what it's like on a daily basis to grow up in those conditions. How does a child formulate trauma? How does a child get negative body image issues? How does a child immediately resort to violence, gangs, wanting to seek approval in other ventures rather than staking on a healthy path? So the health educator, the social worker, the mental health clinician, they are cousins, brothers of the PA, of the MD, of the DO, and we're just focusing on a different aspect of the front line, but we're on the same collective issue.
Yeah, true that. It's really it's an interesting field. It's not. I think that everybody's a health educator in their own right.
Right.
Like your mom told you to wash your hands
Right.
before you eat. When you're a kid, that's being a health educator.
Right.
I think the health education specialist, specifically for those of you guys that are trying to get into that field or learn more about it, it deals with theory, a lot of theory,
Right.
and then the application thereof.
Yeah.
So you got your
Health belief model,
exactly.
ecological framework,
Yeah.
and just to kind of elaborate on that, ecological framework is one of the most important pieces because you look at things holistically as a complete comprehensive system, just like the human anatomy. So the health educator and the physician have that in common. We're looking at things from a very outside perspective, but also we're focusing in on the different fragments. And a health education specialist can look at baseline data, what's been working, what's not been working. What are the socioeconomic, traumatic backgrounds of a community, of a person? What are the limitations? Health belief model, do they see the perceived susceptibilities, threats to their health, or do they need a little bit more of a boost? And are they not contemplating on working on their health? So you bring that theory to practice, you bring those research skills to practice, and you're bringing a comprehensive package, a gift, again, to the work center, whether it's clinical, community, home-based. You can literally implement this in every single form of practice of mental health, physical health, etc.
And so we have about 30 seconds. What do you see as the future of health education?
As we previously discussed, health education's future relies on folks taking initiative to focusing on whatever passion they have, whether it's focusing on infectious diseases, whether it's getting rid of the homeless situation in our urban sites, or whether it's giving young folks exposure to academic material. It's a process of passing down the material and training our young people to become the next world leaders of health. And I only see a great abundance of skills being built upon from that.
Okay. All right, thank you.
All right.
So for those of you guys that may be interested in a career as a health education specialist, I'm going to put the link in the description so you can contact the folks from the National Commission for Health Education Credentialing, or at least visit their website. If you want to be a social worker, I have a friend here, or a physician assistant like me, I'll put those links in the description also. I wish you guys the best of success in your positive endeavors. Please feel free to subscribe to my channel, and I'll answer your questions to the best of my ability. Peace.
All right, folks. Peace.